Thank you everyone for your patience with the setup. As you can see, we are getting our head around the hybrid setup, and it is something that we obviously want to get better at doing, and to make these events more accessible and allow people to be able to come in person but also online. So thank you for bearing with us. I am going to be on Teams as well, so if anything happens and we're not aware that we've gone away, please pop in the chat to let me know when I can fix that. So welcome everyone. Before we begin, I want to acknowledge that we are meeting here in person, for those of us who are in person, on the land of medical people. And I'm aware that we have people from all over the place joining us, so please do share in the chat where you're joining today from. So welcome everyone. We are here for a very exciting event that is hosted by the UNSW Science and Society Research Group. I'm going to get into that in a moment, but I just want to go through a few little housekeeping things just to keep things going as smoothly as possible. So first of all, we are recording this event, so we'll make this available online later. So I know that some people were unable to make this. If you know anyone who would have loved to have been here but isn't here, please let them know because we will share it online. I said a moment ago, but everyone in person here today, the room is mic'd up. So if there's any kind of background noise or anything, please, people who are coming online, let us know and we can let people know that it's getting in the way or making noise there. And also everyone who is online, you can unmute yourself, so just be mindful that you don't accidentally unmute yourself during, but at the end we will be having a Q&A, and at that point we do encourage you to unmute yourself and share your questions directly, but we do have a chat function as well. So we are joined today by Professor Noortje Marres and also Professor Tim Rhodes and Associate Professor Kari Lancaster, and they're going to be today presenting and discussing research investigating science, evidence and expertise in the context of COVID-19. As I said, this seminar is supported by the UNSW Science and Society Research Group, and today Noortje, Tim and Kari will each present critical social science studies, which in different ways will examine how science has been made, translated, contested and made public in the UK COVID-19 policy landscape. So we're going to run each of the presentations back to back, and then at the end we're going to have a panel discussion where everyone can ask questions. So like I said, pop questions in if you don't want to unmute yourself, but if you can, we'd love to be able to hear you, and hopefully we'll also be able to get your face up. Unclear how successful I'll be at that, but we'll give it a go. And then for those of you who are in person, we also have refreshments afterwards. Is there anything else we need to go over before we jump in? All right, so I might just present to you Professor Noortje Marres. So Noortje is a professor in the Centre for Interdisciplinary Methodologies at the University of Warwick. Trained in Science and Technology Studies at the University of Amsterdam, Noortje has published widely on public participation in science and innovation-intensive societies, including in studies of online debates on climate change, socio-material practices of sustainable living, and street trials of autonomous vehicles. She is currently working on the Viva Fellowship, Testing Beyond the Laboratory, and is the UK PI for the ESRC-funded international project Shaping AI, Controversy and Closure in Research, Policy and Media. Her study of independent SAGE was funded by the Participatory Research Fund of Research England. Noortje was a member of the Ref21 panel for sociology and has published 2 monographs, Material, Participation and Digital Sociology. Today, Noortje is presenting a presentation titled On Making Science Public in Times of Generalised Emergency, a Social Study of Independent SAGE. Welcome.
Thank you, Mia, and thank you to the Science and Society Research Group for making it possible to have this discussion today. I'm really pleased that we have that opportunity. So I will be speaking to you today about an ongoing study of independent SAGE. Independent SAGE is a group of scientists in the UK that formed in May 2020 to provide independent advice to the UK government and public on how to minimize deaths and support Britain's recovery from COVID-19. Rather remarkably, Indie SAGE adopted the slogan "Following the Science." This slogan had been used by the Johnson government and had elicited quite a lot of critical commentary when it was first launched, where people questioned the wisdom of this slogan, as it immediately prompts the follow-up question, which science are we following? The science is not quite the conversation stopper that politicians might expect it to be. There was also plenty of humorous responses to the slogan following the science, including by an FT journalist, Stephanie Hare, who declared that her daughter had dressed up as the science for Halloween. And I am very curious to know what her outfit looked like. But perhaps the questioning that this slogan elicits, perhaps this was part of the point for independent SAGE to adopt it, and I will sort of develop that point in my presentation today. So what I will do in this presentation is I will present to you the research design, the sort of conceptual background, and also some initial insights and findings from my social study of independent SAGE. And I will really seek to develop one central claim, which is that for this independent group of scientists, following the science meant, and perhaps indeed required, making science public. So that's going to be sort of my central argument. So it indeed seems that the commitment to and the practice of the public communication of science, as well as public engagement with science, is among the core commitments of independent SAGE, and is perhaps also what is most distinctive about it. So the group was founded by David King, former chief scientific advisor to the British government, which was a different government than the one we were under when the pandemic erupted. And in founding independent SAGE in May 2020, so it was about 3 months after the pandemic became official, the statements that were made in public very much stressed that independent SAGE was committed to providing scientific advice, not just to the government, but to the public. And indeed, many of the activities of independent SAGE bore the imprint of that commitment. So what independent SAGE is perhaps best known for is their weekly briefings. So every Friday afternoon, they would present new data regarding the unfolding of the pandemic. And they would also often invite other experts or partners in society to these weekly meetings, including partners from unions, mayors of British cities, and also representatives of patient groups like long COVID kids, disability organizations. A further key feature of independent SAGE, so that I think it's important to stress at the outset here, is that many members of independent SAGE were also members of SAGE. So SAGE stands for, and we will learn much more about SAGE, I think, later this afternoon, the Scientific Advisory Group for Emergencies. SAGE was founded by the British government in February 2020, so about 5 months before independent SAGE, to advise the government on COVID-19 policy. And many, and indeed most of the scientists represented in independent SAGE were also members of SAGE, which also, I think, right now immediately asks the question, what kind of public science are we talking about then? if the main protagonists of this science for the public were perhaps their primary identity was to be scientific advisors to the British government. So yeah, just a bit of stage setting, so you have a sense of what kind of a beast we're dealing with here. I'd also like to say just a little bit about the broader sort of conceptual concerns and empirical objectives that I bring to this study of independent SAGE. So what for me, as someone who works on public involvement in controversies about science and in my previous research, I've had a strong focus on sort of participation in innovation processes and in scientific research. What for me is very interesting about independent SAGE is that it invites us to broaden our perspective on expert advice and scientific advice beyond to focus on direct interaction between science and policy, or science and government. And indeed, it will be, I think, interesting to discuss with Tim and Kari to what extent that kind of expanding the frame towards public engagement, the scientific advice that seeks to primarily engage publics, what difference that really makes to how we understand science and policy and science and politics interaction in the COVID-19 pandemic in the UK. In the literature, as I'm getting to know it, there is one observation about the British situation that keeps returning, and that is that science and technology scholars tend to, in their analysis of scientific advice, focus on the advice that SAGE produced for the government. And a lot of critical analyses have been offered which argue that the secrecy of the advice that the official SAGE gave, and also the narrow range of the expertise that was represented on SAGE, which did not have as prominently represented as one might expect. For instance, public health expertise or expertise to do with societal inequalities. That these were factors in the then creation of COVID-19 policies and guidelines that did not adequately address the societal challenges of COVID-19, and also meant that policy was guided by assumptions that were not critically interrogated as part of the scientific advice that was produced. And here's, for instance, also issues of the framing of the population as at risk of non-compliance of the population being one of the primary risks identified by SAGE. And of course, all of this is up for discussion, as I hope we'll have a chance to. Second point, to just give a bit of background to my interest in sort of making science public under conditions of a generalized emergency. What I am really interested in is the fact that with public controversies of science that I have studied in the past, there was often a really sharp distinction being drawn between the publics that were affected by the issues at stake and the general population. So in a lot of social studies of like controversies around climate change or life sciences and genetic modification, you will find the discussion focusing on the fact that mobilized publics and the general public form two really separate type of constituencies, which then generate lots of problems of legitimacy around both expertise and counter expertise, but also the legitimacy of taking the controversy seriously as such, if it doesn't really impact the general population, so to speak, or is perceived not to. So the broad public relevance of scientific advice during as the COVID pandemic unfolded is something that I think is very important and interesting in that regard. And also the many different societal divides and sort of polarized publics that organized in the UK as the pandemic unfolded, which gives us a kind of an emergent phenomenon of controversial science that is perhaps different from other forms of publicly controversial science. And this indeed is one of the things I want to explore and see whether the differences as I identify them, whether that was really the right one. What follows for how we understand what it means to do public science. Just one more point of reference is the work by Anne Kelly and colleagues who have been working on COVID-19 from the perspective of the anthropology of epidemics. And one of the points that emerged from that work is that public health crisis generates occasions which might bear some similarity with the situations of breakdown or accident that in the sociology of science and technology tend to be understood as occasions for publics to become involved in the creation of knowledge and also potentially in innovation processes. So there's some concepts or effects that are being invoked in this literature, which I think, well, for me, are really interesting to explore. How then does science become public, and how is science made public under those conditions? Because, again, in other areas, these kind of effects of breakdown or accident and disruption as occasions of public involvement tend to be very much contested, that they're even defined as such. So for instance, in the work on autonomous vehicles, there's a lot of investment on the side of engineering to frame and define autonomous vehicle testing as not a disruption because of various mechanisms in place. So that by way of context. One more way, though, that I want to just dramatize the kind of challenge for understanding public science and its controversiality that is opened up by COVID-19. There's a lot that can be said about the ways that knowledge is contested under the conditions of emergency of our pandemic. But one of the sort of tensions and phenomena that I'm really struck by and concerned with in my study is that in science and technology studies, there's a really established set of concepts and frameworks for understanding what are normally called public knowledge controversies. So they're in many different substantive areas, climate change, here genetic modified foods. There is a repertoire of concepts and methods that science and technology studies invokes to describe how science is forced to become participatory under conditions of its controversialization. As I already mentioned, I've done some work on those index kind of registers, and here on the slide you see on the left a controversy mapping of the debate about genetic modified foods on the web from the late 90s. In studying and visualizing that late 90s controversy, public controversy about genetic modification, what we ended up doing is we mapped what in the literature it tends to be called the extended peer community. So organizations, professional bodies, organized activist organization or organized activist actors that form networks that articulate issues by circulating information about these issues. Coming to COVID-19 and controversies in this area, I am really struck by the ways that the concept of knowledge controversy really would be a bit of a misnomer in trying to understand the ways that knowledge is contested here. So what you see on the right is a COVID vaccination connectivity map created by a researcher to document the sort of anti-vax and vaccination disinformation networks in the UK. And the kinds of organizations that we find on this map, so this is not a mapping of the circulation of information, but an actor mapping, is we find the House of Lords, we find the Conservative Party, we find the UK government, we find all kinds of actors on this map as actors that propagate disinformation in relation to COVID-19. And we can discuss the appropriateness of this mapping, and we should. But what I take as a really defining feature in trying to sort of grapple with that kind of a situation is how the science of COVID-19 in the UK was and is being contested on many different fronts, including from inside institutions. So I'll just give sort of 3 examples of this kind of how science as such is being contested, and sometimes indeed a politics grounded in evidence and a policy grounded in evidence is being contested as such. So we have Rishi Sunak, who claimed it was a mistake to empower scientists during the COVID pandemic, claiming that official SAGE had too much power. We have scientists who are involved in independent SAGE, spending a good deal of their time countering misinformation regarding the safety of vaccinations. And we also have from the right-wing press quite passionate and sometimes bordering on toxic attacks on scientists, including scientists serving both on independent SAGE and SAGE. For instance, identifying one of them as a member of the Communist Party and using this to sort of undermine public health approaches. So I'm spending quite some time setting up, but I think it's important to do this sort of stage setting so that we grasp what kind of, how science meets its publics and how science is at stake in sort of public engagement with the science of COVID-19. Okay, on to my study now. So what my aim is in my social study of this group of independent scientists is to conduct a situational analysis. So rather than studying directly how independent SAGE interacts with its publics, or how independent SAGE seeks to intervene in public debate, the way I'm setting up my study is that I seek to identify and define particular political and public situations of COVID-19, and then evaluate interventions and initiatives in terms of their ability to make a difference in these situations. So in taking that approach, I am drawing on a methodology developed by Adele Clark, and Kari Lancaster also has contributed to the development of that methodology. And I am also working with notions of the public situation and the political situation that have been developed in sociology of science and technology, and also geography of science and technology. So Andrew Barry, British geographer, developed this notion of the political situation, which he defines in terms of underlying asymmetries, distributions, and grievances within society. which in Andrew Barry's work are brought into relief by knowledge controversies. So Andrew Barry very much insists that if we want to understand knowledge controversies and public knowledge controversies, we have to understand how they thematize and activate these kind of wider political situations. And so that's work that I'm drawing on here in defining COVID-19 as a political situation where we find friction and contestation, so not just controversy about knowledge, but contestation of knowledge between citizens and state, institutions and social groupings. Just to add that I've been developing this kind of situational analysis in quite different work where we use digital methods of social media analysis to understand how testing is, and COVID-19 testing and not testing for COVID-19 was articulated as a testing situation in social media as the pandemic started. So this is other work where, I work with similar concepts, and it's just helpful to mention this here. So what is situational analysis? Situational analysis is a method of data mapping, so it's a cartographic method, but it's also a qualitative approach. So situational analysis was very much developed to work primarily with fieldwork data, and then it got expanded to also include document analysis and social digital media sources, which are all things I find very attractive about this method. It proceeds by creating heterogeneous maps. So the kind of issue mappings that are created in these using this method tend to include entities of varying scale and scope, and I think there's a connection here also with the work of John Law that you're drawing in, which very much insists on the heterogeneity of situations. And the focus is on understanding what can make a difference in a situation. So how a situation can either be transformed or recomposed, or the agency within a situation can be redistributed so that new capacities for actions may emerge or may not emerge. And this focus on what makes a difference, I very much like, in contrast to, for instance, notions of impact, which have for me always a very strong binary of either it's achieved or it's not achieved, and there's not much in between. So this brings me then to my question. So this is, how did in the sage scientific advice make a difference in the public situations of COVID-19? You might notice that here I say public situations, other slides I call them political situations. I am very much debating with myself which way to go. So I thought I just left that a bit of indecision. So maybe I can make some progress today on that question. So the research proceeds along two sort of lines. So the first is identifying the strategies of public science that IndySage develops in order to in the attempt to make a difference in public and political situations. So these are strategies of open science, so publishing reports, staging research debates in their weekly briefings, strategies of co-production of knowledge, and translational science is one of the phrases. So we're working with representatives of societal organizations does not just serve to sort of grow public understanding and public engagement with science, but is really becomes a mode of knowledge production. I already briefly mentioned the work with educational unions by Independent Sage in this regard. And the last strategy of engaging publics So here, of course, there's immediately the question of how does this get specified in the work of independent SAGE, what public engagement really is. Yeah, I think I can just mention here and then develop this later that in indie SAGE, a lot of public engagement focuses on sort of providing practical information and useful information for publics with often very practical questions of like how to cope, what to do. Though of course this is not the only way that one can define public engagement, often with science. To make this, in an attempt to make this study somewhat doable, I decided early on to focus on 3 topical areas for identifying engagement with political situations, and also try and identify empirical areas where it becomes possible to speak more empirically about, so what's the situation here? And identified as these areas 3, the development of test and trace, and the special British initiative to outsource a lot of the creation of test and trace infrastructure. Second area, in inequality, societal inequalities associated with COVID-19 pandemic. This was one of, I think, the central areas of contestation where SAGE wasn't really expected to provide any scientific advice that had anything to do with social economic policy or social care issues. And perhaps because of that, it became one of the key areas where independent SAGE sought to intervene. And lastly, I have a very, or somewhat clunky characterization. I refer to it as science-based governance in social institutions. And what I am thinking of here is schools, pubs, airports, all these kind of areas where, for which COVID-19 behavioral guidelines and other kinds of guidelines were developed. To also not have to confront my research participants in the study with the clunky term public situation, I've operationalized this into a more lightweight term, that of the critical moment. So what are critical moments? Critical moments are moments of heightened tension in which taken for granted arrangements are thrown into jeopardy, and the outcome depends partly on what happens. This is a definition that I take from work of David Stark, but it also connects with literature on problematic situations. So critical moment is like, it's kind of a problematic situation. We can actually sort of has some indexicality to it. We can say, look, there it happened. And so what then is my project seeking to do? What's the design? How to ask and then investigate, how is independent SAGE seeking to make a difference using these 3 strategies in relation to critical moments in these 3 areas. So that's the sort of boundedness of my study. Methods are as listed here. So I'm conducting online expert interviews with members of independent SAGE and also societal partners of independent SAGE. So that includes patient groups, unions, but also journalists, and also in some cases, what I think are probably best described as sort of citizen scientists. So individuals who themselves aren't accredited scientists, but who are working with independent SAGE, either on the data side or on the publicity side. I see that my autocorrect has turned my critical moment into something a little bit different. Next step, so what's the aim of the expert interviews is to both identify the critical moments in which independent SAGE sought to intervene, and then to identify their methodological strategies and interventions, and only if it happens to be brought up by my participants, some sense of how successful were they. But in this first interview stage, I'm not asking them to evaluate independent SAGE's impact, but sometimes my interviewees end up doing that anyway, given how they're primed. Next step, what we're moving into now, is to then identify some critical moments and then do a qualitative heterogeneous data mapping of different kinds of sources of data that we collect in relation to these critical moments. And this is both independent SAGE reports, but also can be minutes from SAGE, government documents, transcripts of the YouTube weekly briefing recordings, blog posts, media articles, Twitter threads, but focusing really on publicly available information. And then the last step, which is still in the future, is that once we've created our mappings of critical moments and have developed situational analysis, we would like to bring our provisional analysis back to our participants and ask them to sort of respond, annotate, and give their feedback on the analysis. So in terms of where I'm at, and I should mention that I am developing this analysis together with Oyhan Etayo, who's a PhD student in history at the University of Warwick. And based on the interviews that we've conducted so far, we've started identifying our critical moments, which you see presented on this slide that I hope you can read. Not really? Medium.
Almost all of it.
Okay. Well, maybe what we'll do rather than me reading the whole slide is that if we have a conversation, we can come back to it, and I can just briefly list. So in the first area, test and trace, critical moment is the creation of test and trace. And out of the interviews, we have gathered problematizations in relation to this critical moment, where test and trace is problematized by independent SAGE and its partners in many ways, but one includes the private initiative to which the development and creation of test and trace was handed over. So one of our members received phone calls from a company back in February about the labs and the infrastructure that they were setting up pretty much outside of the established procedures for the tracking and tracing of that is in existence and available in the UK as part of its public health infrastructures. The secrecy around the creation of test and trace. So for a long time, it was rumored that particular companies had received contracts, but this was not in the public domain. But also, and perhaps most critically, the absence of a public health framework in the implementation of test and trace, and its lack of integration with social policy. And I noticed that I'm actually now reading that slide, which I said I wouldn't do. So I'll try and go a little bit quicker. So other moments, so in relation to, and I should just mention, so for test and trace, I identify one moment here, but there are of course many different moments where it is the implementation of test and trace, then the dismantling of test and trace when it ceases to be free. So there are many different moments that I thought I'd not clutter this slide too much at this moment. In relation to inequality, a very important moment for Independent Sage was when it became known in July 2020 that there were significant disparities in both hospitalizations and deaths along ethnic lines. And so Independent Sage has done a lot of work which is named as structural racism in the NHS by some Independent Sage members. Lack of support for isolation. So the fact that the government had in the UK had largely punitive policies in relation to COVID, where failing to report a test or being found to be in any unauthorized location was all met with penalties, and this in the absence for any social economic policy of support. So where precarious workers or others in precarious positions were not enabled socioeconomically to actually comply with these guidelines. Long COVID is also a big area in which Independent Sage works with patient groups. And lastly, Independent Sage has done a lot of work on education, including on higher education, but also lots of work with schools, where they've written many sort of detailed reports and recommendations about the opening of schools, what kinds of conditions would need to be in place for schools to open. And there are different moments in the UK where this became topical, so of either moments of actual reopening of schools, but also moments of a threatened reopening of schools, which then didn't come about. And I mean, for me, gathering these problematizations through the interviews and continuing perhaps also through the documents is a way of getting to the situations. And the reason that I use this word, they're problematizing what the government is doing or what is not happening, is that it gives a way to not just focus on disagreement. Because I have, so in the study of knowledge controversy, there's classically a focus on public contention, what's the point of disagreement? And my sense is that when we speak about contested knowledge and knowledge contestation, it doesn't quite make sense to focus only on disagreement, but we should really focus on sort of what problems are being articulated, are being addressed or not addressed, because it gives us a perspective. So as may or may not be the case for some of you, being in the early process of coding up the interviews, I have a proliferation of codes which I am not yet reducing and resisting actively to reduce. So I thought I'd just give you a bit of a flavor of this, also as it might give you a sense of what kind of what kind of articulations are we finding in the interviews. So you see here one of the bigger, so this is just a frequency, co-frequency mapping. So in government, we have government irresponsibility, government communications, government failings, government experts, government inaction, government policy, and government secrecy. So that is the kind of the way government is specified within the Independent Sage ontology. On publics, we have coping publics, informed publics, public consultation, public debate, but we also have lay publics, we have anti-public, we have knowing public, and we have public space. I will not read you all of them, but to give you point out on expertise. On expertise, there's a lot, of course, of expert advice, but there's also missing forms of expertise. So forms of expertise that are either absent on SAGE. So that's, I already mentioned expertise relating to inequality, but also missing expertise on independent SAGE, which does not include economists. But then there's diversity of expertise and DIY expertise. So in the interviews, especially that focus on schools and education, but also patient groups, there's a lot of discussion of knowing how to sort of practical forms of expertise. How do you build a ventilator if the government is not providing any funding for schools to install ventilators? So DIY expertise is one of them. Okay, and just a kind of one more point about coding is that I'm coding the interview data, and we may also be coding selected documents in using methods of relational coding. So almost all of the codes are used in conjunction with other codes. And so it's a way of trying to get the sort of relational ontology orientation of situational analysis, of implementing that in the coding. And it means that most of the fragments from the interview, and I'll show you some of those in a moment, are coded to more than one category. And so I can just very briefly point out just a few things. So one thing you see in this figure is entirely an artifact of the method, which is that inequality, schools and education, and test and trace are the areas where most of the codes cluster. But that's simply because these are the topical areas in which I'm focusing the research on critical moments. So there's no surprise that those areas are especially populated with codes. But one of the things that might be relevant to note at this stage is that schools and education is an area where expertise actually figures most prominently. Issues around compliance. Well, when it comes to test and trace, there's a really strong focus on government failings and government inaction and government secrecy, so much less, of course, than in schools. And again, that focus on government failings, inaction, and secrecy is also one of the key areas in relation to inequality in the independent stage responses. And another thing to note is that public health is brought up by almost everyone and in almost all of the interviews, as the type of expertise and the type of institutional arrangement that is either being marginalized, dismantled, under threat, what matters. And so it's for me, who does not have expertise in this area, it's really striking how independent SAGE has this really strong investment in public health as a form of knowledge and as a form of translational science that they are championing in the face of its marginalization across these practical areas of implementation. And that's maybe something we could discuss later. I am seeing that I'm time-wise. I should maybe, could I have 5 minutes? I think that's 5, yes. Yeah. Okay, so I'll go quite quickly now because I think I'll just identify a few of the themes that emerged from the interview before concluding. So a big theme is how expert advice is being politicized. So here we find a in-stage member who explains it tells the story of the creation of Independent SAGE, explained that they set on SAGE during previous emergencies, and said with COVID-19 it was a completely different story, the way in which SAGE functioned. So SAGE, as it was convened to address COVID-19, was a far more political structure. There were not just civil servants, but government advisors, personal political advisors were sitting there, and that was really what we were concerned with. Other cases of the politicization of expertise were brought up. One member with a background in behavioral science described how when SAGE came with advice, behavioral science-based advice, that the Cabinet Office would just convene another advisory group on the fly because they didn't like the advice that SAGE had provided, which gives you the sense of the Bertolt Brecht, like, oh, we don't like this science, let's get this some other science. Second emergent theme, predictive science versus policy translation. So this might get us into the territory of sort of epidemiological modeling and public health paradigms in approaching COVID-19, where Independent SAGE was not critical of predictive science as such, and not critical of the reliance on modeling in SAGE advice, but really making arguments around the restrictions on drawing out policy implications. So making the claim that within SAGE, experts were not really allowed to draw out policy implications from their scientific advice, while in Independent SAGE, there was a strong sort of emphasis on precisely doing that. So if the science shows that the infection is spread, then it automatically should follow that you recommend that policy creates restrictions that prevent that. So on the Independent SAGE, we're willing to draw out the policy implications of science that wasn't done by the mainstream process. Critiques of the dismantling of public health infrastructures that I alluded to, but done within sometimes in a political repertoire. So speaking about the hollowing out of the state, that the dismantling of public health arrangements in the UK well predated the pandemic. In other cases, this kind of critique of the sort of public health capacity not being made use of adequately in government policy was also made on scientific grounds. So sometimes this argument was made on political grounds, sometimes it was made on scientific grounds. I've got 6 themes total. Should I do this? Go quick? I think I will go quick and just mention one last theme, which is something I already mentioned, which is the emphasis in Independent SAGE's sort of self-narrativization. So the sort of the account of Independent SAGE is that, unlike the government, Independent SAGE really focused on providing practical advice. So the public had all these searching questions. They had intelligent questions, which are the questions put to Independent SAGE during their weekly briefings. So they would ask, how can I protect my loved ones? How can I protect a disabled child? People needed to ask these questions. They didn't have the answer. And that really was that need for practical advice was the one that Independent SAGE provided. And this is contrasted with the press briefings provided by the current chief scientific advisor, which were characterized as, these were more like student lectures, like as if you were in university, you would be lectured at by the chief medical officer who would sort of lecture you on how the epidemic was unfolding, but did not really provide any of that practical advice. So 3 main points then, and then I will really stop. Approaching the study of independent SAGE out of an interest in these sort of shifts in how knowledge is put at stake publicly. So how do we understand contested science if our interest is in participation and public engagement with science? Clearly, the conditions of contested knowledge are very different from the conditions of controversial knowledge. One of the risks I think we're dealing with is that of expert disagreement being at risk of being overshadowed by attacks on scientific orthodoxy. So that's also, I think, where I see a lot of value in independent SAGE sort of critical interactions. This focus on conditions of generalized emergency, so the way in which a pandemic is seen and defined as affecting the whole population instead of sort of affected minority publics. What comes out of the work on independent SAGE is what becomes salient in this condition, that it is really the contestations of the models and the remit of expert advice. So how transparent should it be? How secret should it be? What should be the balance of expertise? Translational versus predictive science and associated models of science policy relations. The politics of public science in the face of minimal state. And then finally, what I hope to do more work on is on this difference between sort of paternalistic and empowerment-centered approaches to public communications of science, and how to understand what a difference that makes in relation to the critical moments as I have.
Yeah.
Okay, thank you, Noortje. Now, I saw a few people were joining online a little bit late, so just to say that we are going to be having a Q&A at the end. So at that point, you can unmute yourself and talk, but also feel free to pop some things. If you think you're going to forget a question, you can stick it in the chat from now. We'll get it to it at the end. So now we turn to Associate Professor Kari Lancaster. Kari is a Senior Associate Professor at the Centre for Social Research and Health here at UNSW and is an Honorary Associate Professor at the London School of Hygiene and Tropical Medicine. She leads a program of qualitative research focused on the development of critical approaches to the study of evidence-making practices and intervention translations in health. Informed by science and technology studies, Kari is currently investigating viral elimination and outbreak science in the governance of health, long COVID care and recovery, and the effects of novel addiction treatment technologies. Kari today is presenting the thing we call evidence toward a situated ontology of evidence in policy. Welcome, Kari.
Thank you, Mia. It is an absolute pleasure to be here today, and I'd just like to start by acknowledging that we're meeting on the land of the Gadigal people, who are the traditional custodians of this land, and pay my respects to elders both past and present. It's such a serendipitous and wonderful opportunity to bring the work that we've been doing in the context of our evidence-making interventions and health program of work together into conversation with Noortje today. And already I'm seeing so many things that I can't wait to get into discussion and to talk about this afternoon beyond the seminar as well. So Noortje is absolutely the headline act, and Tim Rhodes and I are supporting this afternoon with a few shorter presentations just to give you a taste of the work that we've been doing in the context of COVID-19. We have a long-standing interest in the relationship between science and society, evidence and policy within our work, and as the COVID-19 pandemic took hold in 2020, much of our work pivoted in that direction, and that's some of what we're going to be talking about this afternoon. So the challenges thrown forth by the COVID-19 pandemic have laid bare this illusionary promise of a technical, rational, linear process of evidence in translation for policy, and has illuminated the need for more nuanced ways of thinking about evidence as situated and processual. These idealised conceptualisations of evidence-based policy are ill-equipped to deal with the uncertainties in evolving situations of need. In the early stages of the COVID pandemic, there were calls to follow the science, follow the evidence, and this became a rallying cry for action. But the limits of this cry were quickly felt as governments scrambled to respond to a novel coronavirus by implementing largely untested interventions that radically disrupted ways of life, with model projections of potential effect, speculatively generating these multiple scenarios and filling in the gaps of what could be known. What it means to follow the evidence has in many ways been altered. The relevant question is no longer simply what works, but rather what constitutes evidence enough for intervening in the unknown. And the answer to that question is always situated and relational, in the moment, value-laden and political. So we're suggesting that the case of COVID-19 is a prompt to new thinking, not only about how evidence comes to bear on policy, but also about the nature of the thing we call evidence itself, reconfiguring this as a situated achievement, something that's made in the here and now of policy deliberation events. So in this short presentation, I want to propose this critical move towards a situated ontology of evidence in policy, which disrupts how evidence has been characterised up until now really as being something that is for policy. And we're suggesting that redrawing the debate about the relations between evidence and policy in these ontopolitical terms and reconfiguring evidence as a situated achievement helps us to appreciate how this thing we call evidence is enacted in the events of policy deliberation and not merely before it, with its translations actually constituting transformations into different things. So by shifting towards this situated ontology of evidence in policy, we can begin to notice how the practices and relations of policy deliberation enact the thing we call evidence, and in doing so perform a following of that evidence, even as it's being made, performing evidence enough for action. So we're using this phrase, the thing we call evidence, quite deliberately here to open up the simple familiarity and presumed stability of evidence for policy, reimagining this thing as complex and entangled and relationally constituted and transformed in events of policy deliberation. So it's an approach which allows us to attend to the practices and relations which work to enact the thing we call evidence, as well as how the making of the evidence in the event of policy deliberation performs evidence as a thing having been followed. That is a difference which has been made after, and it was fantastic to hear Noortje talking about that difference then. So while what is the evidence is often posed as a question which seeks to remove politics and bias in an evidence-based policy approach, acknowledging the ontological politics at work allows for a different kind of mode of questioning, which seeks to notice the realities being negotiated and shows us how it could be made otherwise. It allows us to take evidence as a thing, what Bruno Latour called a gathering, that is historically, culturally and materially located. But then we ask, located where? And to answer this question, we need to pay attention to the science in which the thing we call evidence is made, to events of policy deliberation as the transformative situations in which evidence is done. So rather than envisaging science as having made the evidence over there somewhere, which is then put into translation, here we're focusing on tracing the ontological transformations in how science is made to perform as knowledge in a specific situated assemblage of policy practices and relations. So this requires us to investigate the thing we call evidence together with and not isolated from the practices and relations which enact it, and also as a thoroughly political concern. Which brings us to this scene, an otherwise mundane and very dirty whiteboard in an office in London. In May 2021, Dominic Cummings, the former chief advisor to former UK Prime Minister Boris Johnson, was called to testify before the House of Commons inquiry into lessons to be learned from the response to the coronavirus pandemic so far. The remit of this inquiry was explicitly about the relationship between evidence and policy in a time of public health crisis, convened as the UK in 2021 continued to bear the epicentre of international attention as the pandemic has continued to unfold. Dominic Cummings' appearance before the committee was anticipated as what was called a box office moment. Cummings' candid account attracted significant controversy as he described the monumental incompetence and dishonesty of government officials, a lack of planning, and a failure to follow the science and take advice. In the days leading up to his testimony, Cummings posted a series of comments to Twitter, outlining his observations of the decision-making processes and events which had unfolded inside these highest echelons of the UK's government in the early months of 2020. Accompanying one of these tweets was this image here, which was labelled Prime Minister's Office, 10 Downing Street, Westminster, England, United Kingdom, 13th of March 2020. So here we've got an image which zooms in on this dirty whiteboard outlining in crude terms Cummings' rationale for dramatically shifting away from the UK's previously announced mitigation strategy to instead implement a full lockdown suppression strategy, which was going to prevent the National Health Service from collapsing. So in the top right-hand corner of the whiteboard were the initials of key actors, the Prime Minister, the Chief Medical Officer and scientific advisors. And then laid out on the rest of the board are 6 points. 1, no vaccine in 2020. 2, must avoid NHS collapse. 3, to stop NHS collapse, we'll probably have to lock down. 4, lockdown, everyone stays home, pubs, etc. close. 5, what's the difference between plan A and B? Full lockdown before collapse, which means about 2 weeks before we catch up with Italy. The 6th and final point at the bottom of the whiteboard posed in stark terms what was fast becoming far from a hypothetical question. 6, who do we not save? Amongst the text, Laura. Amongst the text on the whiteboard were a series of hand-drawn curves, figures representing modelled projections and transmission dynamics and the possible effects of this shift towards a suppression strategy. These figures that have become far too familiar as calls to flatten the curve continue to reverberate globally. So this extraordinary image garnered media attention, and there was much speculation as to what it revealed about the evidence and advice underpinning the government's deliberations and shifting priorities in that crucial period in March 2020, which was fast becoming a catastrophic public health crisis in the UK. As well as being shared on Twitter and in the press, this image of the whiteboard and the tweet also featured explicitly in Cummings' testimony before the inquiry, figuring as a material object in his storied account of events which had taken place in Downing Street. So in many ways, this dirty whiteboard might seem like an odd choice of empirical material to work with. So why have we selected this as the thing to attend to how evidence is in the process of being made? This is not evidence as we would usually have it represented to us. It comes in a very different shape and form. It's publicly shared not to provide reassurance of authoritative technical decision-making, but to perform chaos, panic and dysfunction, all of which had circulated in private behind closed doors. So these squiggly lines are not carefully translated models of projected intervention effect. The figures of the curves are free-drawn, unenumerated, unreferenced, erased are the complexities of method, data, parameters, reproduction number, and any careful translational efforts. This modelling, if we're to recognise it as modelling, has escaped its reasoned calculus. But inside this intimate moment of deliberation and crisis, we've been retrospectively allowed to glimpse, through its being made public, these model projections which have not been carefully translated but transformed. The squiggly line sketched on this dirty whiteboard is a powerful actor in this scene. For a moment on this whiteboard, this is the evidence, enacted as a thing which was being followed. In the here and now of the policy event, this hand-drawn squiggly line constitutes evidence enough for action. So this rather unconventional scene, this dirty whiteboard, offers a case for analysis that allows us to attend to how evidence is being performed in these fluid and malleable ways through invocation and implication, imagination and relational connection. It allows us to attend to the situated ontology of evidence in policy, in all its politics and mess. So how is this thing we call evidence enacted in this image and in its associated story as a thing which was being followed even in the chaos of crisis? This image itself is, after all, a product of practices, and practices we rarely have such privileged access to observe. And it could well have been assembled differently, and it might never have been made public. Indeed, going public is part of what we need to attend to in this assemblage. It's a story and an image that tells us who's important. It's also something which is multiply located. It's in the Prime Minister's office on the 13th of March 2020, privately snapped, but it's also on Twitter, gone public on the 26th of May 2021, and enduring online in multiple media formats since, shared publicly and strategically amidst these controversial revelations of a highly politicised and much scrutinised inquiry. The whiteboard performs differently in all of those different sites of practice and performs differently in our analysis here now as well. This whiteboard and the complex assemblage of relations and practices of which it's an artefact is working to enact the thing we call evidence as a thing being followed. But how's it doing this? So just to say briefly, let's look at the curves. The figure of the model and the curve itself, as we know, has become ubiquitous in the context of COVID-19, and models have played a critical role in producing evidence in response to novel viral outbreaks and generated evidence for rapid decision making, and Tim's going to talk about that more soon. But at the time this image goes public and during the inquiry in 2021, these curves and this modelling, this model society, this flatten the curve call, is already legible and a familiar household kind of figure. It can become this thing we call evidence because it's being enacted in relation to this social and political and scientific and cultural practice within these particular networks or systems of circulation. So tracing the figure of the curve against this hinterland, we can begin to notice how the thing we call evidence is enacted and is detaching from science and becoming remade as a distinct object. Here, performed not only as recognisable, but also consequential for policymaking. This figure of the curve nestled inside this dirty whiteboard, inside those 6 points, is implicitly rendered as a central object around which decisions are taking place. So these hand-drawn curves might appear at first to offer a window onto reality, and some of you might recognise this report from Imperial College and also recently featured in the This England series. I was happy to see. But these connections are part of this illusionary work that's being done as evidence is eventuated as a thing which is being followed. So one version of the evidence-based policy story, the evidence-based story of March 2020, is that this particular modelling study dramatically shifted the UK's previously announced mitigation strategy to one of suppression. This report, this graph that we're all quite familiar with was led by Professor Neil Ferguson at Imperial College and was released to the public on the 16th of March 2020. It was used by the government to explain and rationalise the policy change later. We can perhaps see traces of this particular model and its suppression strategy on the whiteboard and in Cummings' tweet. We might assume that the squiggly line corresponds to that in the report and has been brought in via translation. One might see the squiggly lines as reference points to tacit evidence that's assumed to sit behind and before. But on the whiteboard, the methods, the maths, the science, the careful equivocation, the distancing in this report's conclusion recommending a suppression strategy and its backing off from matters of ethical and economic concern, and the delineation of the roles of the scientist and the policymaker are all erased. There's implicit work being done here. Realities are being made in the wake of research findings. So it's these hand-drawn curves with its erasure of method and scientific precision resituated in these complex relations that is the thing being followed, that legitimates decisions being made. It's not mere representation via translation, but transformation. It's the hand-drawn curve on the whiteboard in the story and not the model or the scientific report per se that is the evidence. So one can argue that it might not be this curve which informs decisions, but rather other mathematical modelling generated by science. or we can suggest that this curve somehow offers a window onto some other stable reality. But what we seek to notice in the figure of the curve in this image and the story of the whiteboard is how science generated elsewhere by mathematical modelers with all kinds of precision and assumptions is being enacted anew as the thing we call evidence in particular and distinctive ways in the context of Cummings' tweet on the 26th of May 2021 and as it's continued to circulate in media reports into the joint inquiry and beyond. So we're attending to these curves not to trace the concrete pre-existence of evidence as if it had come before, but rather to notice the qualities of evidence in the making and how it does this illusionary work. It's this image and the account of the lockdown deliberation event released to the public and the media in the context of an inquiry that allows us to see the curves enacted as evidence as the thing being followed. It's the going public of this moment that allows for an account of action being taken on the evidence, even if that action was mired in chaos, failure, and politics. It's in the event and in the public demand to account for the relation between evidence and policy, including in the explicit remit of the inquiry to uncover lessons learned, that the thing we call evidence is being made. So evidence isn't outside of the political, it's enacted in public and within it. So as the image of this deliberation event goes public, this isn't a mere translation, but a far more radical remaking. So where does this leave us? Noticing evidence as a situated achievement shifts our focus to the practices and relations involved in its becoming and opens up possibilities for alternative configurations of the worlds in which the realities of evidence are being produced. This is an approach, we hope, which helps to appreciate how evidence is done and performed as a thing followed, emerging as a thoroughly political and public concern and as evidence enough in the face of uncertainty. This approach, we suggest, allows us to encounter evidence in new ways. We find that evidence-making events necessarily force a letting go of reason calculus and of the locations in which scientific knowledge is made. But it's precisely this detachment which is the difference made in evidence-making events. It's through letting go that the thing we call evidence is transformed as a thing followed and as a thoroughly social and political concern. Evidence doesn't sit behind or before policy deliberation, but is inside it. The enactment of it as a thing followed, part of its eventuation and how it is made to matter. By thinking with this approach, what's messy is not defective, as Isabel Stengers would say, but an onto political concern that we might attend to more closely, noticing the productive effects which make a difference to worlds and lives. So this move towards a situated ontology of evidence, from evidence for to evidence in policy and its extending chains of relations, has implications for the socio-technical and socio-political arrangements of the evidence-based policy movement as we know it, and its place as a governing paradigm. But we're arguing in some of the work we're doing across the evidence-making interventions in health program that in a time of public health emergency, we're all the more aware that it's no longer desirable to proceed as if there's an imagined separation of science and politics which might be maintained under the rubric of the cry for what works. Science and the social, as I don't need to convince anyone in this room, are entangled and relational, and the decisions are value-laden and political and have multiple unanticipated effects. Rather than seeing these political entanglements as a failure of the technical rational ideal of evidence-based policy as we know it, we're proposing an approach which allows us to attend to how evidence is being done. And this leads us to ask if the thing we call evidence is being done well, if it could be made otherwise, and promote a mode of questioning that allows us to attend to other matters of concern. I'll leave it there and hand over to Tim to talk about more models, chaos, and the UK response. Thank you.
Thanks, Kari. So let's go on to our final speaker for today, Professor Tim Rhodes. Tim is a Sharp Professor of the Sociology of Health at the University of New South Wales and a Professor of Public Health Sociology at the London School of Hygiene and Tropical Medicine. He uses qualitative methods to explore the social relations of evidence-making practices in health and care, especially in the fields of infectious diseases, pandemics, drug use and addictions. He is currently working on the social study of mathematical models and other forms of evidence in pandemics and outbreaks and on qualitative studies of COVID, COVID care, drug use and drug treatment. Tim today is presenting Evidence in the Wild, the Uncomfortable Science of Mathematical Models in Policy. Welcome, Tim.
Thank you very much. First of all, I'd like to acknowledge the Vegetable people, who are the traditional custodians of the land, and pay my respects to elders, both past and present. And thank you very much, everybody, for being here. It's great to be part of this. I'm looking at the time, and I don't know how much time we have left, so I'm going to try and be as quick as I can. But if somebody could nod to me, after about 15 minutes, because I left my stopwatch over there. So following on from what Kari has said, we're going to look at a case example, if you like, of evidence constituted in the event of policy. And we're going to turn to an example which involves mathematical models as a way into this case study. And as we've mentioned, we've been collaborating with various mathematical modelers involved as scientific advisors in the UK COVID policy response over the last few years. And I think we can all agree that the mathematical model has played a pretty prominent role in how we come to know COVID-19. And in some ways, we've become familiar ourselves and even thinking like a model and fairly used to ideas of flattening the curve, exponential growth, reproduction number, doubling time, and so on. So in the UK, as has been alluded to, there's two main committees which are involved in advising Cabinet Office and government in terms of national policy decision-making around COVID-19. The first was a committee known as SPI-M, which is a scientific pandemic influenza group on modelling, which reorientated itself to COVID-19. And the second committee involved is SAGE, the Scientific Advisory Group in Emergencies. And SPI-M produced models, synthesized models into consensus statements, which they then passed up to SAGE, who then passed those up to Cabinet Office to inform government policy making as advice, or at least that's the theory. And there's quite a lot of people involved, actually. I think there's probably about 50, 60 mathematical modelers and other scientists involved in this kind of infrastructure, particularly SPI-M. And most of them are mathematical modelers, with a smattering of epidemiologists too. So the consensus statement is an important feature of this infrastructure. So we're going to be looking at some of the accounts of modelers themselves, and we're also going to, I think, be interested to see how those accounts perform as evidence, if you like, of a story in relation to models on policy. We're going to tell the story by focusing on one particular moment of controversy in the public announcement of England's second lockdown, which occurred in October 31st, 2020. And then we're going to trace some of the things which modelers said about this event as a way into understanding how evidence is a thing made in the event and transformed in its implementations. I want to say a few background words if I can, but I think I should shoot through these rather quickly. And just nod to me if I'm going on for too long. First of all, models in pandemics. Pandemics, I think, are usually performed in science and policy as crises or emergencies of some kind, which are characterized by uncertainty. And key thing there is that they're unknown threats of potential unprecedented magnitude, right? They're big threats. So it's the unknowability of the threat that creates the capacity, if you like, for precautionary as well as unprecedented action, such as national lockdowns. And mathematical models are one form of anticipatory governance that are used in these crises as a way of somehow controlling or managing them. And they govern in a way as a kind of bridge, if you like, in the face of uncertainty to help plan, prepare, and ideally preempt. And they do this, as we all are probably aware, through things like forecasts as well as scenarios. And I just want to say a couple of words on each, just so we get some kind of background in the sense of where I'm coming from. Forecasts are usually short-term, and they're kind of like predictions, really. They're not always predictions, but short-term forecasts often are. about what could or might happen. And they're usually offered in the now, with their uncertainty apparently kind of reduced or tamed as empirical evidence is gathered and they kind of see greater correspondence with the real out there as time goes on and we get to know more. That's short-term forecasts. Scenarios are longer-term kind of envisionings or imaginings, in fact. And they tend to be more abstracted and more speculative, much less predictive. They're less to do with probabilities and more to do with possibilities, okay? So they're less judgments on what might happen, but they're more questions about what could happen, possible futures, if you like. And then, as we heard a lot in the UK, at least, in relation to COVID-19 policy deliberation, there is this thing called the reasonable worst case scenario, which is something that governments use to kind of predict or plan. And these are usually more scenario based, so they're longer term kind of envisionings or imaginings, but they're said to be plausible enough, evidence enough upon which to base policy, but are not considered predictive. And SPI-M did a bit of all of those. It did a lot of short-term forecasting in the now. It did what it called medium-term forecasting, which it considered to be, the now extended to a few weeks. And it also did some longer-term scenarios, one of which we're going to focus on in a minute. But of course, from the outset, and I don't need to say much more here because Kari's already foregrounded these ideas, we are treating evidence as performative, as a thing which is made in its implementation event and situation. And we can do this with models too. So rather than presumed stable or independent or pre-existing, we see evidence as something which comes to be in its eventuation, a fluid thing that is performed in its situation, rather than a fixed a priori object to be taken up and used. So we're interested in how models and their projections come to be and come to be transformed in their implementation events. And just to say, because I don't have a slide on methods, we can talk about it later, because there's interesting stuff there too, I'm sure. We spoke to 29 mathematical modelers across all the kind of main groups involved in SPI-M and SAGE, as well as modelers not involved in the government scientific advisory infrastructures. Around half are involved actually directly as scientific advisors, if you like, and about half weren't. And the last word of background relates to scientific consensus, because this emerges a lot in modelers' talk, both in terms of how SPI-M kind of saw its role, as well as their accounts of evidence and how it was used or put to use or not by government. So consensus, of course, is one device in model evidence making that could be seen to ostensibly smooth the translation of evidence in policy. The scientific consensus and the consensus view which SPI-M and other kind of advisory infrastructures produce can be seen to benchmark, if you like, what the scientific view is, coordinating the evidence, if you like, or the science, as if it's in a singular space upon which policy can then be legitimately kind of grounded. It also presents potentially or performs a united front of kind of joint agreement amongst the modelers. And that also helps in a context of controversy or uncertainty where there might be differences at play. In a sense, consensus helps being at ease in terms of putting out the science. Now, the performance of the consensus view and consensus at SPI-M was really its raison d'etre. And on the bottom of this slide, you've got an extract, for instance, which is written by Graham Medley, who chaired the SPI-M committee throughout the pandemic time. And this is a paper recently published in a special issue around modelling and the COVID-19 pandemic. And it makes very clear, if you like, how the chair, at least, SPI-M saw consensus as kind of a driving or core kind of mechanism by which this infrastructure worked. And the title of this very paper is A Consensus of Evidence. Right, let's get into the event as a way into talking about some of these issues. So this is a graph which appeared on the BBC National News on October the 31st, 2020, in support of the Prime Minister Boris Johnson's announcement of second lockdown, which just lasted for 4 weeks until November the 5th. Now, the projections of daily deaths from COVID-19 presented on this graph became hotly contested almost immediately. You see 4 modelling groups represented here, London School, and that's the place where I work, alongside UNSW, Imperial, Warwick, and the University of Cambridge working with PHE. Now, the outlier, the worst case scenario amongst these 4 estimates, projected a December peak of 4,000 deaths a day, based on an assumption of 1,000 a day by early November. And that's nearly twice as much as was projected by the second worst case projection in that slide. Now, out there, the news and reporting kind of went crazy, with some media depicting these as death scenarios, apocalyptic, leading to the nuclear option of an unwanted lockdown because there's no alternative and so on. These were overestimates, perhaps 4 or 5 times too high. SPIEM was accused of misleading the government, or misleading the public rather, by cherry picking the scariest of data. So that's the graph that was presented alongside the announcement to second lockdown on national TV. It was based on a graph which had been produced 3 weeks earlier by SPIEM on October the 9th. So this is the SPIEM version of the same graph, which you've just seen transformed by the BBC in its own kind of eventuation. And there's subtle differences, but there are differences which are nonetheless there, and they're kind of important, I think. I mean, the first thing you can see from the SPIEM graph produced 3 weeks earlier, ostensibly the same evidence, but what you can see, first of all, is the BBC version loses all the confidence intervals around the projections. Also, what you get with the SPIEM version is quite a few words of caution as well as explanations. So these are stressed in capitals as early working analysis. And in capitals in bold, at the bottom here, you can see these are scenarios, not predictions or forecasts. We have then a very, very simple instantiation of the ostensibly same evidence made multiple and transformed in its different implementation events. Evidence performs and governs very differently in each of these enactments, especially as we can see here in relation to certitude. Now, the interesting thing here also is that these data, this graph, was leaked to the BBC, so no one at SPIEM or SAGE had any idea how the BBC had come across these projections, which they used to announce, or the government used to announce, second lockdown. Let's get into what some of the modellers were talking about in relation to interviews we had them about this particular event, and then we can generalise from it, perhaps a little bit more so. The first thing, according to modellers' accounts, is that these projections are not projections. These are not projections in terms of what we think would happen, but a reasonable worst case of what might happen. The estimates were produced to illustrate a new variant, we are told, of how bad it could be, that became sold outside scientific circles as a forecast. So this is a longer-term scenario, reasonable worst case projection, which came to be used and was put to use in a very different way as a prediction of what was going to happen, 4,000 deaths a day by December, and presented. Second, as I just said, these were not current estimates, but were made a month before, and they were leaked, and they were an inflection of their situation at the time when we weren't sure. These are modellers speaking. I'm not going to do inverted. I'm beginning to look a bit silly. Third, modellers drew attention to the fact that the public communication drew particular attention to the worst case outlier, which is a long way off the others. And this caused quite a lot of consternation because SPIEM and SAGE felt they had signed off on an updated set of the more statistically rigorous projections as consensus for the government to use already, that they didn't appear. So as we can see in this slide, there's a sense that this is a textbook kind of example of how public communication in a pandemic should not be done. So we're in the realm of messy translation and what is going on there. Now, in models accounts, we're moving, I suppose, to some extent to the idea that evidence is indeed a thing performed. And in their accounts, they're emphasizing, for instance, that evidence is being put to use here to act politically rather than scientifically, in their words. As it says on the slide, they decided they would make more of a case, and that was done for purely political reasons, a political calculation. For some scientists, the leaked outlier estimate gathering attention, in fact, was not very well evidence-based, and some described it as rubbish. Yet in policy, it performed very well. It was very useful. It looked worse. So as the modelers themselves recognized, the veracity or the accuracy of their projections is not the matter of concern here. The numbers, in fact, are a side effect. They're working in a narrative, they're working in a moment, they're being made to work because of their situational fit, here to perform a pandemic that is worse and big and that warrants unprecedented policy action. Were it not time enough. It's got 5 minutes left. That's just terrible. So, what am I going to do? Cut lots of material. Okay. Yeah. Right.
Not too much, I hope.
Well, no, I've got far too much here, so I'm going to have to make some drastic cuts, and I'm sure it'll all piece together somehow. What this slide is doing is drawing attention to what we've identified as two linked elements in modelers' own narratives of the problematization of evidence translation. And that's evidence misused on the one hand, and the other is policy failing to use evidence as it should. And you can see here the first extract draws attention to the collateral damage and the undermining of science involved, where evidence is so-called misused. And the second extract draws attention to the fact that, well, we have plenty of evidence already out there, pre-existing, ready to use, to be transferred into policy, entirely in keeping with an evidence-based policy imaginary, as we've heard. Now, what scientists do, and I'm going to skip over it, is a lot of work behind the scenes to try and bring this evidence translation mess to try and clean it up, if you like, and to try and bring policy nearer to science and so on. And indeed, the very projections we saw on those slides, the reasonable worst case scenario ones, were proactive projections. They weren't commissioned by government. They were put out there by the modelers as a means to try and push the government to act, because the reasonable worst case scenario it was using in June had far been outdated by the actual number of cases. So these were proactive moves to try and smooth the mess, if you like. There's a sense through this time of consensus being ignored. There's multiple examples of this, and some of them are great to get into in detail, but I don't really have the time. But the idea is that the science wasn't being used, it was ignored. They never listened to the science. SPIAM had been hammering at it for many months. We saw the uptick in cases. It was so clear there was going to be exponential growth of untold magnitude. We were signaling alarm. The consensus statements in August and September were warning of a breach in worst case scenario kind of thresholds. There was a lot of shouting and screaming going on within the realms of the generous constraints that an independent advisor could get to do. So as this second extract here illustrates from an advisor quite close to government, that it was pretty clear what was going on. It was well communicated to ministers, it was well communicated via unofficial channels and so on. But as scientists, some scientists, most scientists said, we were ignored going into the second wave. So we're in a situation of having to live with the mess while scientists are trying to smooth it out and clean it up as best they can according to this evidence-based policy imaginary. The second extract on this slide is from, again, a scientific advisor. He was talking about this being a kind of discounted science. You know, the right decision was made for the wrong reasons. It's bad science, it's undermining of science, but you know, we're going to have to go with it. When asked what's going on, I think one of the most common narrative or explanations in modelers' accounts is that things are different in an emergency. So here we see this kind of depiction of the virtual cycle of evidence-based policy as it should be, you know, where there isn't an emergency, which apparently gets completely broken in a time space where you've only got a week to give an answer. So models give answers. There's no feedback loop, as is articulated or imagined here. Models just go into the ether. It's described as a kind of fire and forget modeling. So it's the emergency situation in which consensus making and evidence translation is breaking down. So let me move to conclusion. I think there's two main logics of consensus trouble that we can trace in the accounts of the scientists we've interviewed. The first is that the emergency situation troubles the relative certainties of evidence making and the chance of error. And this kind of affects an uncomfortable science in many different ways. But the accounts here accentuate the uneasiness of consensus making in a time compressed situation, largely as an epistemological problem, okay? And the kind of extracts on this slide do this. The second in a more kind of radical way, if you like, where the emergency draws attention to kind of what are described as irreducible uncertainties of science, telling us what science is really like. Right. And the second logic of consensus trouble, as we just heard, is the failure of consensus to translate. And here consensus use is troubled by evidence-based policy that's not working as it should. So when scientists perform, evidence is ignored or miscommunicated or not followed or listened to, or of evidence having failed, what they are doing is enacting policy processes as the problem, not the evidence and not the consensus. As said here, science is a beautifully constructed mechanism, but it's let down by the evidence-based policy. So let's make some conclusions. I mean, first, we offer this as a rather straightforward example of how models and their projections come to be as evidence in situations of implementation, and how that is evidence not merely performed, but also transformed. Second, we can see, or we're arguing or describing this as generating an uncomfortable science, which is affected by living the trouble, as well as playing the game of evidence-based expectation. And the consensus making itself is a trouble device of translation. It doesn't smooth out or clean up or make easier this mess or complexity. And treating modelers' accounts themselves as performative, I think what we see is that the accounts of troubled consensus don't so much challenge evidence-based policy imaginaries as actually hold on to them. These accounts of mess and of evidence translating or not translating well are largely presented as epistemological challenges or problems. They don't fundamentally challenge or resist the hinterland of expectation or the idealization of evidence-based policy working as it should. And this is what we've described as a situation of acting as if, enacting models and policy as if they are independent from the other, as if evidence is stable and singular, as if policy is consequential on science. But acting as if doesn't smooth out or resolve the problems of evidence translation, it extends the disease. And I think that's our main point. So to conclude, we need another way. As we said earlier, we need a way to resist the consensual view, if you like, of the situation that's being presented, to think altogether differently. And because of time, I'm just going to leave you with an extract here, and we can work out between us what it might mean. If we feel uncomfortable without clear, definite, and singular accounts, clear, definite, and singular structures, then that is how it is. However, if we are able and willing to tolerate the uncertainties and the specificities of enactment, flux, and resonance, then we find that we are confronted with quite a different something. in quite a different set of important puzzles about the nature of the real and how to intervene in them. Sorry if I went over time.
All right, I'm thinking we might now look more to the front. Does that make the most sense? Or yeah, let's do that. Now, just a reminder to those of you who are tuning in from home, I can read out things from the chat, but you can also unmute yourself, so just let me know if you have a question. And I was thinking to kick off, considering that we've kind of jumped from Noortje's wonderful kind of like going through the landscape and introducing us to all these concepts, and then we've had these two case studies of, I guess, evidence almost escaping and breaking out and going into these different places and being performed as misused or messy or however we want to think about it. Noortje, I wanted to invite you to maybe reflect back on the thought you had about the moving between the public and the political and not really having a place to land, and I'd just ask if you've got any more thoughts on that since then.
Yeah, I mean, there's so many threads we could pick up, and so it's a bit of a challenge of which one. But maybe I can make like 2-3 remarks. So one is, what I find really interesting is that if I understand Tim and Kari correctly, they are coming in some ways quite close to a translational understanding of the evidence and the role of scientific advice. So when you say the evidence is in a way internal to the policy sphere, or when you highlight the sort of unrealistic expectations of the scientific view, sort of providing the disclosure that it can't really provide outside of the policy information process. Yeah, I hear you point towards it's always translation. It's never just advice. Yet, from the perspective that I think I've been taking, SPI-B and forms of evidence like flattening the curve are is the type of scientific expertise that often gets held up as the type of knowledge that doesn't take its translational responsibility. And indeed, the suggestion that SPI-M would only is only able to sustain its exceptional sort of independent, indispensable passage point kind of role within the scientific policy process because it claims to provide evidence and not translational science. So, I mean, of course, I want to be careful about metaphors of cakes and eating them and looking at them. But so I think there's interesting questions that we could explore around that, how sort of both the exceptional epistemic status of the modeled projection, how that's, how the sustaining of that, how that combines with the kind of accounts that you have developed. And then maybe just 2 points to make a bit more quickly. So one that I'm very, two points that would be interesting to discuss is that I think, as you noticed, I set up my account very much around the mirroring of sage and independent sage, which is a complex interaction and a complex divergence and convergence narrative. But it means that we're always talking about the evidences. And so on that point, I'm also wondering about, this critique of unification performed through the evidence, and the notions around mass and heterogeneity and relationality, which is often connected with ideas of multiplicity. We have multiple evidences. So how do you relate to engage with this multiplicity of the evidences? And then just very quickly, last point, I won't elaborate, to do with the question, the big one of like, where's society on this? Because one of the big sort of acts of magic, I think, of that early period, and also still in the period in October, that somehow the curves of projected deaths and also projected hospitalization could come to stand in for what COVID is doing to society, or how COVID is impacting us. While a lot of the other sciences, I guess, would continuously insist that is not an adequate translation of society. So, like detaching the evidence from the science, how are we, detaching the ontology of COVID from society? And to what extent is that? Can we see a kind of a necessity or an inevitability of those detachments as well? And I don't want to just pose it as a critique. So I think those are some content would be interesting to discuss.
And I will say as well, I know we're at 4, we'll go to about 10 past because we have some technical difficulties at the beginning.
I know you should have to answer.
No.
I thought I saw a hand.
Oh. Thanks a lot. Just amazing presentations. It's so fabulous to see. I wanted to just ask you about the heritage of the term "follow the science," and push that in a couple of directions. So, 2008, there's a campaign for science and engineering premised around saving science, in which we're not following science, we're actually saving science. And so 10 years later, where science is in different sort of positions, so actually now the public is behind science in a different kind of way, and we're following them. And I wonder if a key move, as you were chatting, I kept thinking about the Britpop wars, and Oasis and Blur and Elastica, and like you can almost think about the different scientific groups as like bands, right? Like I'm with Elastica, or I'm with Blur, or I'm with Oasis, or whatever. And this is sort of kind of personification of science as scientists. And in a kind of way, there's a calibration between these different kind of groups, not in the same way that Blur and Oasis calibrated their public performances in a way around each other. Mm-hmm. And the whiteboard, Kari, is very similar to that, right? Like there's the dirtiness kind of it invites you to think, well, who actually drafted, like who actually wrote that bit, and who did that bit, and when that who spoke those words, and we all know their names, we know their biographies, and we're looking for like the political gossip under the scenes, or we're looking for that person didn't follow the advice that they were giving in public, the Boris Johnson drinks, all that kind of shit, So we're looking, the personification is this really interesting thing that's kind of happened in kind of a funny way. And I just guess I'm wondering, is that helpful? And is there a kind of calibration that's happening? So they're dancing with each other in a funny way. Mm-hmm. Mm-hmm. Like Elastica or Blur or Oasis.
Oh, look, anything that brings Britpop and Oasis and Blur into conversation, I'm totally there for that. I think the history is really interesting, and as someone who has a policy background who's now working in sort of STS and health, I find it really interesting the different ways that story is told as well, whether or not you're coming from an evidence-based medicine kind of background, which is not where I was coming from until I started on this trajectory, but a policy trajectory traces the kind of history and account of evidence-based policy, which absolutely actually locates to the Britpop era and Blair and what matters is what works, and that kind of becoming a catch cry that just resounded sort of throughout Western democracy, really. But But because of those two kind of accounts, evidence-based medicine, evidence-based policy, I'm really interested in the moments when it's following the science and when it's following the evidence, because both are used. I am also interested in it from a kind of public health point of view, where the assumption, I think, amongst many of the people we've interviewed, is that actually when we're talking about evidence-based policy, what we're talking about is evidence-based medicine, and the two things are kind of have different histories and different genealogies to kind of trace and think about. I think putting it also in the context of, you know, the cry of what matters is what works, sitting within kind of a 90s science wars sort of context. There's a lot to unpack there, and then the kind of movement and protest more recently, you know, kind of post-truth era, if that's what we want to call it, around the name of the protest is now escaping me, but the kind of protests in support of science that years ago as well, which absolutely, and I think that a part of the research that I don't think we've dug into quite enough, and I'm really looking to Noortje's work for this, is about how that goes public as well, and where exactly the question you posed, like where is society in that? And just in the call for follow the evidence or follow the science, I think we as researchers and as STS scholars as well need to be kind of careful in what we're talking about in terms of our object. Like, are we talking about the object of science, or are we talking about the thing we call evidence? And I think they're two different things, and that's what I've been trying to kind of bang on about for the last couple of years. And I think it's important to think about what's going into the making of those different objects. And just as we can't sub evidence-based medicine in for evidence-based policy, I don't think we can sub science in for evidence either. But that's probably a whole other conversation.
Isn't science evidence-based?
Sometimes.
It's not science. It's not evidence-based.
There are different ways of thinking about how something becomes evidence-based, and I think that's a very question.
You can have evidence without science.
You can have evidence without science.
And then you get the science from the evidence. If there's something you don't know, you see the evidence. Underpins that.
You enact it as science. I quite like your question about thinking of it as Blur and Oasis, kind of, and who do we follow? Because within the sciences which make up evidence for use in COVID, there are many. They're multiple. They're moving around all the time. I was intrigued as you were talking earlier, actually, in terms of how SAGE enacts itself as a kind of infrastructure, and how its own claims might alter in its own political situation, which have clearly changed over time. But the account we've just given of modelers, for instance, working in SPI-M and a little bit in SAGE, it's a very particular kind of science. It certainly doesn't get anywhere near the kind of science you might have had located in SPI-B, but it also doesn't give enough away, really, of the other sciences, which are maybe being followed in different ways, as well as closed off and absented from SPI-M and SAGE and from government advice. And certainly within the UK modelling scene, there was more than one camp of science. And there was definitely a place of Blur and Oasis. And what we haven't really given to mention here is all the kind of modelling, which was which was kind of dealing with different matters of social and political concern, actually. It was less about, tracing viruses through populations, and had as their objective concern the social and material effects of lockdowns and pandemics in societies. And not all of those models had the same kind of degree of access within the infrastructure as the NDFOC did.
So you're suggesting science siloing?
Definitely. I think what's interesting, it would be beautiful to have been there to observe how the consensus making process was done, what models get in, what models don't get in, and how those judgments are made. But then you also, I think, according to some of the models we've spoken to, some of whom were not involved in SPI-M or SAGE or the scientific advisory structures, there's a whole other world of modelling out there which, didn't get the same kind of capital.
Would be nice, of course, if you didn't get COVID and died, in which case it wouldn't be so nice.
So, yeah, mindful we're 10 minutes past, so I might just open for like any final comments and then might wrap up and have some refreshments.
I'm quite interested in how the evidence going public is such a disaster story in how you have presented it. Because, and this is where, I mean, the kind of mirroring of the different bands and analyzing the strategies and accounts that the different bands provide. I mean, it is interesting to put them next to each other because I think the key term associated with SPI-M in the materials that I'm looking at is secrecy.
Right.
So not making enough of its
Yeah, it's
public.
interesting to put our stuff together because there's all sorts of accounting in terms of how you do the work of independent scientific advisor well, performing yourself as sufficiently independent whilst trying to clean up the mess in order to do a good job and get stuff and evidence out there and somewhat way more public. So, yeah, it's not simply secrecy or working secretly. This stuff to be,
Yeah, no, it's, and of course, like, but there is a kind of that making science public and addressing publics in the independent stage sort of register of justification or narration. It's very much tied with, look, the public is far more intelligent. The information needs of the public are far more specific. I mean, there's a whole kind of a re-specification of the publics of science that is happening, I think, through the independent stage work. So, and I am struck by the mirroring. You know, there is a lot of contrast that is suggesting itself, I think, and that makes a juxtaposition of our accounts, I think, really worthwhile. Yeah. And I think the point of reference to the scientific protests is an important one. You know, the moment in the UK where an establishment figure stated publicly that the country had had enough of experts, and yet the capacities of scientists to sustain their sort of work on the scientific view as what, you know, is so rigorous and robust that if it enters the policy world, it must surely be the policy world that makes the mess out of it. I mean, I think those two things occurring sort of, it's an impressive story of parallel worlds that at the same time reflect one another, I think.
I think that's been one of the most fascinating things in doing this work, and we've interviewed locals in Australia as well, and in the context of other viruses, including Hep C elimination. And I think what we're trying to do is also kind of turn the mirror back to the people we're interviewing and working with and saying, you know, how do these accounts, as we're remaking them, resonate with you? And often there is such a desire for a different articulation of a different story that's just not available to people within the scripts of evidence-based medicine. And so STS work, I think, has such an important place in that conversation, including also bringing to light, you know, who gets to be inside and outside, and the privilege of what it, you know, the privilege and the mess of some of these processes and what's going on inside those rooms as well.
Yeah, and I think there is potential there for doing modelling differently and more speculatively, which is what we're interested in pursuing, and not just predictively, which I think can lend itself to the more kind of translation evidencing that you're talking about, as more of a derivative process. So a lot of the models we're speaking with are very, well attuned to thinking speculatively, and not averse to that kind of experimentation or intervening either.
All right. Well, I think we're going to leave it there. Thank you everyone for coming and for those online. So let's once again thank Tim, Kari and Noortje for their presentations. So for everyone who's here, we have refreshments for those of you at home. Thank you for joining, and we will hopefully have the recording up soon to share.
Thank you, Mia.
Thank you, Mia. Thank you, everybody.